Most textbooks on the social development of infants and toddlers mainly focus on temperament and attachment. While both are fundamental constructs for social skills, the development and growth of specific social skills during the first 3 years of life are often ignored or minimized. Developing social skills to enable successful relationships with others is one of the most important accomplishments in childhood. Conversely, when children fail to build social skills properly, or their skills do not function effectively in the early developmental phase, they subsequently display challenging behaviors and experience later social maladaptation, school maladjustment, and poor academic performance. Figure 1 presents data from a study that sought to identify longitudinal profiles of social skills from over 1,000 children between 2 and 5 years of age. 3 social skills were examined: cooperation, for example, the child helps someone voluntarily; self-control, for example, the child behaves if there is a need to do so; and assertion, that is, the child initiates conversation with someone. The data present 3 important findings. Social skills grow throughout early childhood. Across each of the 3 social skills assessed, cooperation, self-control, and assertion, there are patterns of upward growth. As children become older, their social skills improve. For all 3 skills, the youngest group, 2-year-olds, perform the lowest, but with every year gained, social skills improved, with 5-year-olds scoring the highest. There are important early individual differences in social skills. The 3 colored lines in each graph represent different groups of children based on their social skill levels and their longitudinal trajectories of growth. Even within the same age group, some children scored higher than others across the 3 skills. As an example, if you look at the graph for cooperation scores, at age 2, notice how there are already, by 2 years of age, differences between children as some scored higher and some scored much lower than others. For each social skill, individual differences were found already by age 2. Furthermore, early individual differences at 2 years of age was longitudinally meaningful. Children who scored higher at age 2 for all 3 skills also scored higher at age 3, 4, and 5. Children who scored the lowest at age 2 for all 3 skills continued to score the lowest at each age assessed. It is important to note the trajectory of growth between the groups. Children in the highest and middle performing groups, blue and green lines, showed the steepest trajectories of growth. They scored higher at age 2 and demonstrated exponential growth through age 5. In comparison, while the group that scored the lowest at age 2 showed growth in social skills every year, their trajectories of growth were not as steep as the other groups. Social skills begin to develop in infancy and toddlerhood. In this study, each social skill was first assessed at age 2, and at this age, individual differences are already apparent, especially between the highest, blue line, and the lowest, red line scoring groups. Although data was not collected before age 2, the clear difference between the highest and lowest scoring groups suggests that these skills are developing before age 2, during infancy and early toddlerhood. Why do some children have higher social skills than others already by 2 years of age? Where do these early forming individual differences come from? The researchers also collected information on the caregiving practices of the caregivers and found that each caregiving practice was positively associated, both increased, with children's social skills scores. Caregivers who demonstrated more cognitive and emotional involvement, less restriction and punishment, and more social stimulation and social support had children who scored higher across the 3 social skills. These results highlight the important role caregivers have in the early forming and long-term trajectories of growth for social skills. The present results are consistent with those of previous studies, which have demonstrated that the quality of early caregiver practices is related to social skills later in childhood. In summary, children's social skills grow throughout early childhood, but there are important early differences between children. Children with higher social skills at age 2 have higher social skills every year through age 5, and children with the lowest social skills at age 2 continue to lag behind their peers socially through age 5. As early differences in social skills can be seen already by age 2, this suggests that the infant and toddler years are significant for establishing a foundation of social abilities associated with later social skills. As infant and toddler caregivers, the interactions we have with children, the environments we create for feelings of safety and security, and the activities and age-appropriate curriculum we implement should have quality relationships at their center.